I feel very honoured to be here because you may not know, but I'm pretty much a newbie myself. I'm the Dean of Life Sciences. I've been in that post for just a few weeks. So it's been wonderful for me to explore a little bit about what this group does and about the MIWA project. I think it's fantastic work that you're all doing and very important. I'd particularly like to welcome people who are external to UCL, to visitors. It's great to have you here, and I wish you the very best for the rest of the day. Now, just to remind you that we're celebrating the 6th anniversary of the group, but also the conclusion of this important MIWA project that has undertaken work in Brazil and Madeira and looked at these very important digital technologies that can help us with understanding vector-borne diseases. I think it's fantastic. I hope that you have a good afternoon, as I said. And I also wanted to remind us that this has been an all-female leadership group, a collaboration between Patty, who you all know, Kate Jones from CIBA, that's the Centre for Biodiversity and Environment Research, and Luisa Campos from Civil Environmental and Geomatic Engineering, and with partners in Brazil, Turkey, and Madeira. You have an excellent lineup of speakers. I hope you've had an excellent start to the day, and I wish you the very best for the rest of the afternoon. And I look forward to seeing you all back at UCL at some time in the future. Thank you very much. Have a great afternoon.
Thank you so much, Gail, for the wonderful introduction. It was a privilege to have the Dean of the School of Life Sciences coming here with us today in the afternoon to welcome you all. So let me just second herself. I also would like to welcome you all, those who are part of the MIWA project, and those who just came because you are interested in vector-borne diseases, mosquitoes, Brazil, or Madeira. It's my real pleasure to invite our first keynote speaker, who is the Minister of Health from Madeira, and who will be joining us online. Unfortunately, due to some unforeseen commitments back in Madeira, he was unable to come in person to London, but he has made the time to join us over Zoom. So you have something to look forward to. And before we get to our keynote speaker, I'd just like to give you a bit of an introduction about what dPHE has done for those of you who are new to our center, and also what the MIWA project is all about, to set the scene for our great keynote speakers and 2 strategic panels. So dPHE, as Gail said, has been set up 6 years ago and is a center looking at digital public health, which before COVID, everybody used to say, so what do you really do? What is digital public health? Now, after COVID, it's a household name. Everyone knows how combating emergencies, epidemics, and outbreaks is really important in our developed world, but also increasingly important in low-income settings. dPHE is delivering a part of a research agenda which is related to outbreak detection and development of serious games and mobile apps. We also do teaching our students who are interested in digital health, and it's great to see some of you here, both PhDs and some MSc students. It's exciting, you got hooked on this exciting topic. And we also work with a number of external stakeholders like WHO and organize events. So this is the map I really like. We made it to almost every continent except Antarctica. And I'm still working on getting to Antarctica as well. There must be some exciting public health agenda down under as well. So our projects are really spanning the globe, and our main focus in the last few years have been working in Brazil on the MIWA project. You will hear about a lot today. And also we have a spin-off sister project in the wonderful island of Madeira. You also will have some introductions from. And we work in Asia, in Africa, and of course in Europe. So I'm proud that the dPHE is not just kind of getting academic papers out there like academics are meant to do. It's great to actually be rewarded by some of our work by industry institutions and competitions. So myself and my teams have been really proud to get industry rewards, Innovators of the Year, and prizes by a prestigious UK IT industry, for example, rewarding our project in Nigeria, designing behavior change intervention to improve compliance with prescribing antibiotic resistance. So being kind of one of the little academic projects among industry giants having multi-million funding to deliver their intervention. It's been amazing to receive so many of these prizes in the last few years. And as I mentioned, we also organize events. So our annual celebration, you are part of today. This is what we bring together around one of the topics of our research every year. And we also organize a conference. The dPHE conference has been a great venue for people to mix together from academia, from industry, and from public health sector to discuss the hot topics in digital public health. And we have decided to stop it over COVID years because I don't believe in online conferences, and it's going to be restarted going forward next year. I also would like to mention the second logo, Frontiers in Digital Public Health, which is a journal run by Frontiers. It's an online open access journal. I am the chief editor of this section, and I am really proud to welcome Frontiers as a sponsor to this event. So if you have any questions regarding publishing in Frontiers, you can speak to Catherine at the breakout sessions or in the evening. And I would like to really join us in applause for thanking Frontiers for their support to this event. So we're also launching a special issue. It's called Research Topic in Frontiers, looking specifically into digital public health and the vector-borne diseases and One Health agenda. So those of you who are thinking about publishing something in this sphere, also looking at the topic from kind of climate change perspective and the future of the vector-borne diseases spreading from tropical climates to medium climates, this will be a special issue research topic which was launched today, and would welcome any great publications. So if you want to speak to me or Catherine at the back, and we also have our guest editors here, so there will be a lot of chance to discuss the research topic if you're interested in publishing in it. So just a quick slide. So it's not just that we are being rewarded by some industry bodies. Me and my colleagues have been also picked up by some media organizations who have been interested in publishing our research, again, outside of the kind of typical ivory tower, to make it visible or available to general public. And one of the prize I'm most proud of, dPHE received the Center of the Year award by Competing Rising Stars in 2020 for the work we have done around COVID, designing a special app to improve the mental health of people during lockdown called My Lockdown Journal. If you're interested, this is something, again, we can discuss later. And we're celebrating our 6th birthday. So what do we do? So one of the important topics, which is often called the slow pandemics, is antibiotic resistance. So a set of our projects is looking at how we can use technology to improve antibiotic resistance, especially prescribing and overprescribing, which is one of the major causes for the rising issue of antibiotic resistance. So our GATSDA project has been an award-winning app improving behavior in prescription in surgeons in Nigeria, and now we're working in the NHS to improve prescriptions for UTI in the community. And you can see the success for the GATSDA to illustrate how the app has changed 4 components of the behavior, and how this has been really improving before and after using the app. It was gamified, so there are loads of kind of awards you could have won. But actually, our last paper demonstrated it wasn't the gamification features which have been the most popular in keeping people using the app. It was a WhatsApp group, and we're having lots of discussions online, giving people awards and the best surgeon of the week for their engagement and entering new students, which actually have been more effective in getting the surgeons in this project for 6 months to use the app than those official kind of gamification awards, which is very interesting result we're going to be presenting in our next conference. At the bottom, you can see there's a green and red little dog. So this little dog is a mentor. So in serious persuasive games, the character of a mentor is a persuasive character which gets the user to do something or change their behavior and has got a cloud of authority. And it was exciting to see that after loads of animals and humans and objects we discussed with our surgeons in Nigeria, they have chosen dog as the most ideal mentor appropriate for their culture to change, to act as the mentor in the app to change their behavior. And successfully, it actually did change the behavior around a number of questions of prescribing. The second project, as briefly mentioned in our 6 years history, is called Mantra. And it was one of the most humbling projects, traveling all the way to Nepal, to rural parts, where we have been using serious games to improve understanding of maternal neonatal health and geohazards among women in rural areas. Some of the women have never used mobile phones before, so it was exciting to see how quickly they could actually pick up the usage of phone and how quickly they have learned how to use touch screens, and actually we also demonstrated an improvement of their knowledge before and after using the interventions in the community. And you can see how excited they are and how the focus group after the interventions have also demonstrated an increasing interest in the agenda and usage. And last, before we get to MIWAR, is our award-winning My Lockdown and was renamed Activity Journal app, which was launched very quickly during the COVID lockdown time and allowed people to record their daily behavior and indicate how much they enjoyed it, either indoors or outdoors, when the lockdown was getting a little bit easier to manage. And we could have a very interesting longitudinal data from our about 1,200 users recording their behavior, in some cases daily for several years. And we have learned how their behavior has changed and how they responded to the change of the regulations and public health messages at the time in the UK. We also look into Twitter discussion and how people responded to messages coming from a variety of governments around the COVID time and how much they responded in either appreciating it or criticizing it. So we did a topic analysis, and most of the people have been quite critical around, especially in the US and the UK governments, with their response to COVID, which isn't too surprising knowing what has been happening, especially in those two countries. So getting to MIWAR, so this is the focus on this week's anniversary. So it's a project which is using mobile and IoT surveillance tools in Brazil and in Madeira. We also are using this data to develop an early warning model to be able to predict where mosquitoes hotspots or breathing hotspots might be. So we have done a great study in Madeira. You will hear about from our colleague Ella a little bit later. And also you can speak to us during the poster session, because we have experts from Brazil and from Madeira all working together over the last two days to share their best practice and improve surveillance going forward. So we have two sites in Brazil. We work in Campina Grande, which is in Paraíba, and in Recife, in the state of Pernambuco, both in the kind of northeast Brazil. You might remember the devastating Zika outbreak in 2014. So the epicenter was in Recife. So this is our main hotspot. And our second site, which has been a result of lockdown and inability to travel to Brazil at the time when the project started, is in the island of Madeira in Portugal, in the middle of the Atlantic, with very similar climatic conditions as in Brazil. However, in Madeira, the mosquitoes are at the moment not infected. So the surveillance work is going on in the same way. However, there is no need to be preventing cases like it is a major ongoing struggle in Brazil. We have worked with so-called environmental agents, and I'm proud to have several agents from Brazil and from Madeira present here today who are doing this routine operation, going around properties and over traps where they are checking if there is mosquitoes and they are eliminating them. And they use our app to report if the mosquitoes are or are not present. So this invisible work, which many people don't even know is happening, is really essential to control the population of mosquitoes and prevent transmission to humans and human cases. So the project has got these two sites, initially Campina Grande and Recife, and then the island of Madeira in Portugal. And in addition to developing the technological solutions, the IoT and the mobile phone technology, we have also looked at how water and sanitation plays a crucial role in preventing mosquitoes breathing hotspots, which is a major issue in a country like Brazil due to sanitation challenges in some parts of those two cities. So again, that's something you will hear about during the panels and the session. And also we look into how we could leverage data coming from a variety of sources, including weather, socioeconomic deprivation, environmental data, land usage, vegetation usage, and how this could be all brought together into an early warning modeling to help us predict whether mosquitoes might be breathing and make the work of these agents more effective. So these are the three core work packages: the surveillance, IoT, and mobile phones, then the water and sanitation, and finally is the early warning and the modeling. So just a quick glance of what the app looks like. So this is a pretty basic app for capturing the data, which at the moment are being recorded on a paper form in both countries, which is inefficient and quite often doesn't get digitized at all. So the whole reporting and statistics, which could be done on the data, at the moment is not possible. And the app is a solution how this problem could be overcome. And the app feeds into a dashboard where the data could be visualized, and also the work in Brazil could be allocated to specific agents to visit certain areas as their kind of weekly routine surveillance. And it gets, at the moment, manually exported to the state level. So this, again, is something where the reporting and the data flow could be all digitized. An exciting work which is done by my PhD student, Aisha, who will speak about this later, is using IoT sensors, water sensors and weather sensors, placed in the OB traps in those two countries to be able to seamlessly monitor the environmental conditions and predict mosquitoes breathing in those areas. So Aisha and I traveled to Madeira, where we have excellent support from the agents to monitor these conditions for over a year. So we have a longitudinal data from these sensors where the modeling was made possible in a way it just wouldn't be possible without the IoT sensors. And that's what they look like. So these are sensors in ovid traps, these little black buckets. This is where mosquitoes are laying their eggs on the red strip, and the other sensors are monitoring the water and the weather conditions. So bringing it together, the project has got these three components, and the IoT and the app, together with a survey of the sanitation and water conditions in those specific areas, has been bringing together the whole knowledge which will feed into improvement for mosquito surveillance at the operational level, availability of longitudinal, geo and spatial located data for modeling, and also for development of dashboards in the future to help the agents manage the work and also report it to the higher levels, national and international level, going forward. So while I have mentioned we work in Brazil and in Madeira, this is the distribution of Aedes aegypti. This is the mosquito responsible for transmitting Zika, chikungunya, and dengue fever at the moment around the globe. So it is kind of in tropical and global south countries at the moment. However, due to global warming and climate change, it is expected this is going to be growing and become a major issue in middle climates. So we can expect, according to the UK HSA report published before Christmas, that by 2050 we will have a dengue and other tropical diseases endemic in the UK. So that's the introduction. I want to thank you to the dPHE team for all the hard work, and also thank you to the MIWA team members who have done an amazing job over the last 5 years. And I'd like to welcome our first keynote speaker. So just a quick introduction. So after the first keynote speaker, Dr. Pedro Ramos from Madeira, we will have two panels. One panel is chaired by excellent Kate Jones, who will look into the agenda of modeling and the climatic change implications for vector-borne diseases. And the second panel will be chaired by myself, looking at the real-world implications and challenges we have faced in this project to enable a collection of a geospatial enabled data. And then we have a WHO second keynote speaker to close the session. I welcome Diane at the end, who will speak about how WHO is addressing the One Health agenda and what we can expect at a global level to combat tropical or non-tropical diseases using digital and other technologies. And from 7 p.m. after the second closing keynote, we're going to go outside to the hub where we will have poster session illustrating the outcomes from this project from the different countries, and we will have drinks reception. So you are most welcome to stay until 9 p.m., have a glass of wine, and talk to all of us about this great research. So that's what you can expect today. It's my great pleasure to welcome Dr. Pedro Ramos with us, who unfortunately couldn't come in person, but it's great to have you online. He is the kind of equivalent of Regional Minister of Health in Madeira in Portugal. So his title is he works in the regional government in the island of Madeira. He is a medical doctor. His interest is looking into trauma and oncology, particularly breast cancer. He also has served several years in the as a clinical director of SESARAM and EPERAM, which are the two organizations responsible for public health surveillance in Madeira. And his particular interest is how we can bring technology and digitization to improve the healthcare in the beautiful island of Madeira. He's going to share with you his vision for the new hospital, and also how we can look around the whole Atlantic and how digital opportunities will emerge, new ways of collaboration to improve healthcare in the Atlantic. So welcome, Pedro, and the floor is yours.
Thank you very much, Professor Patty Kostkova. First of all, apologize to all of you. but my schedule didn't allow to be present there in the University College of London. I want to give you an idea what is going to be the Atlantic health system from Madeira Island in the Macaronesia region. I want to start to give my compliments to Professor Taylor Gill, Dean of the Faculty of the Science University College of London, and Professor Patty Kostova. Congrats for the 6th anniversary of the Digital Public Health in Emergency of the University College of London. For me, it's an honor and a great pleasure to speak with all of you in the house of the best university in the United Kingdom, 2024. And we know that you belong to one of the 10 best university in the world. So it's an honor and a privilege to me. What I'm doing, what I have done, 27 years of clinical practice as a general surgeon, is resumed in 2 pages. But Patty Kostova already gave to all of you what is my areas, my subjects, my interests as a trauma surgeon, emergency department, catastrophe situations, and the oncologic problems. Also in data and management with several courses in these areas in the last few years. I want to give you a message what is going to be the health system of a little island in the Atlantic. The new concept for our new hospital that will be ready in 2027 is a key hospital. We will have less 200 beds than the actual hospital, and we will have knowledgeable, intelligent, wise, and interoperability. And this is the future for the healthcare system in every part of the world. We learned a lot with the pandemic situation. One word becomes an important word in everyone who works in a health system. That word is change. We need to change how we do previous to pandemic situation and what we need to do after 2021. Innovation will be the key for the future in our hospital. We will have one direction, health development in Macaronesia. One compromise that will be health for everyone, everywhere, in every moment in Macaronesia. One objective, health and well-being in every age for all. And we are worried what we are done. We are worried with the results, with the outcomes, because we want less morbidity, less mortality, more public health, more integration of care. Portugal is now in the forefront of the e-health in Europe. The new National Health System portal is a potential game changer for access to service information. Literacy will be very important in our population in the next years. Digital is about humanization and not the contrary, but is also about inclusion. All the elderly people need to be digitalized. Madeira has a plan for transformation, digital transformation until 2030. For us, it will be very important, the new leadership, but it also is very important and is very essential, the involvement and participation of all professionals in healthcare decision-making. This new leadership needs to have leading with care, needs to share the vision, needs to evaluate the information, needs to have a better connection between the service, needs to develop capability and new capability, needs to inspire all the professionals, needs to have people be influenced by the results, and needs to have a really and a truly team, an engaging team. This is the challenge for the future. On the left side, you can see our hospital. In the right side, the new hospital. This is how the organization is made in Madeira. Our health secretary, our Minister of Health of Madeira Island has 4 identities. An Institute of Health Administration, Civil Protection is running by us also, and the SESARAM and the Health Directorate of Madeira. The Institute of Health Administration was created in 2008, integrated in the indirect administration of the Autonomous Region of Madeira and the supervision and tutelage of the Regional Secretariat for Health and Civil Protection. His mission, the Institute of Health Administration, aims to ensure the management of financial and human resources, professional training, facilities and equipment, IT systems, and direct administration service for the Health Secretary. The Civil Protection Service, created in February of 1982, was integrated directly into the presidency of the regional government, and by June 2009, the Civil Protection of Madeira is created and stays in the dependence of the Regional Secretariat for Health and Civil Protection. The Health Directorate is a central service of the direct administration of our autonomous region, analyzing the dependence of the Regional Secretariat. The Directorate of Health aims to regulate, guide, and coordinate, and the coordination is by Professor Bruno Gouveia, that is there with you at this moment. Coordinate health promotion, disease prevention activities, define the technical conditions for the adequate provision of health care, plan and program the regional policy for quality in the public health system, as well as ensure the elaboration and execution of the regional health program, and also the coordination of national and international relations of the Regional Secretariat of Health and Civil Protection of Madeira. The Health Service was created in September of 1973 by the Admiral Alberto Deus Rodrigues Tomás, President at the time of the Portuguese Republic at that time. The first hospital was designated as Funchal District Hospital. By July of 2003, we changed the designation to Central Hospital of Funchal. SESARAM aims to provide quality health care to those in need, develop research and training activities, and ensure technical and logistical support for the development of regional health programs. This is our portrait. 3 public health hospitals, 7 private health hospitals, 200 doctors, 1,200 doctors, 2,000 nurses, 1,500 technicians, and 1,900 technicals of assistance of health. We have 47 primary care, 95% of global cover. 8 centers of our districts has 100% of cover. So we are following the objective of the WHO that in 2002 says that we need to have a full cover in all over the world. Our organization has 6,000 health professionals. In these pictures, you can see the primary care centers, and in the right, the new unit of the other island in Puerto Santo that it will be ready in 2026. This is one of the private hospitals, and this is the other 3, and we have more 3 just for mental disease with 700 beds. Our distribution for our doctors, nurse, psychologists, social assistance technician in every region of Madeira Islands. We had started recently, after the pandemic situation, a new integration of care. Specialists go to the primary care center. General surgeons is made little surgery in the primary care centers, and we have also another specialties like immunoallergology, nephrology, and orthopedics that made appointments in the primary care centers and avoid the needs that the people needs to go to the hospital. To change, we need to know what is the trends for the next decades. They are evident. Health system, we will have more patients, more old patients. We will have more technology, more information. The patient has an ultimate consumer. We need to develop a different delivery model. We need to innovate. We know that we will have increasing costs, so we need to start to not do things, but do the things better. And we need to have sustainability. We also have increasing numbers. We will have less pay for providers, and we will have the continued need for a new healthcare system. Some differences are already in the present. We are moving from digital to smart systems. We need to organize and have a complete capture of data. We need to have people with experience and advanced analytics. And we need to provide care anytime, anywhere, with the right professional in the right place. This is a new area where they are expanding digital health landscape with the new mobile health, with digital therapies, with new health information technology, with new device sensors and wearables, with a personalized healthcare. We start the era of the precision medicine. And we need to use telehealth as a very good instrument to make easier the accessibility to our patients. I think I am very glad to be part of this time. It's a great time to be in healthcare because we are changing, because we are using technology, because we are using personalized medicine, because we are rethinking the pathway to grow, and because we are more near our patients. The last decade, they said that it was a decade of the new medical products, equipment, hardware, consumables. The current decade, it's a decade of the medical platforms, the wearables, the health analytics, the big data. The next decade, that is the present decade, is a decade of the new medical solutions. The robotics, augmented reality, artificial intelligence, and with new intelligent solutions with evidence-based approach, creating a difference in the healthcare segment. So we have a new direction. We have a new challenge. This will be a digital challenge that will bring us more security and more quality. Our regional plan 2030, it is related with the identification of the clinical and personal needs and with dynamic care planning and delivery. We are joining for the new routes in the healthcare system. Once that is very important, I don't know if you have the same problem in the United Kingdom. We need to retain our human resources, because if you don't do that, our doctors, our nurses are moving from the public health system to the private health system. This is a new area where we need to look in another way to the task shifting and still fix. Everyone can do different things if they have a proper education program. The future, 2/3 of our medical assistants is going to be outside the clinics and hospital. It will be at home. The monitoring of our patients, the therapeutic of our patients, the rehab of our patients, and the contact with our patients. Some people think that digitalization and digital transformation will bring unemployment in the future. This is wrong. 4 in 6 occupations in the future will be related with health, with home health aides, with personal care aides, with nursing assistants, with registered nurse, and so on. As I told you, we are facing a new area, the unicorn area. It's a new area. We need to make our health system robust, strength, with beauty, with appealing, with more empowerment, more satisfaction, more secure, and more quality. And the miracle world is change. We are just across the 600 discovery of Madeira and Porto Santo Island in 2018 and 2019. We just crossed the pandemic situation through the two recent cycles, the knowledge cycle and the technology cycle. 600 years of Madeira begins with the cereal cycle, with the white gold cycle, sugarcane, the wine cycle, the tourism cycle, and these two last one, the knowledge cycle, technology cycle. What we are going to do in the future in our healthcare system, our path, it will be always value-based healthcare. This is our strategies for monitoring chronic disease, running by our Health Directorate of Health in Madeira and by Bruno Gouveia. We are worried about quality and security. And so the quality index, we are following the patient report outcome measure, the PROMS, the PREMS, the patient experience measure outcomes, and the PROMIS. We are working also for a new strategic plan that brings to Madeira health system sustainability with preparation of pharmaceuticals, with domiciliary care, with the hospital care, with the introduction of fragile units in our hospital that makes the transition when the patient has the discharge from the hospital, and with artificial intelligence and telehealth. We need to obtain gains in the health system in the present and in the future, with improvement the accessibility, improvement our capacity to respond in the mental health system, with digital transformation, with more interoperability, with more accessibility for the citizen to the healthcare system, and with more efficiency and rationality of our healthcare system. This is the costs that Madeira has when we compare Portugal with Madeira. More than 206 euros for citizens, and we need more 51.9 million euros if we compare with the systems in Portugal. And this is results in 2021 if we compare what it costs the health system in Portugal, what it costs the health system in Madeira, because we live in an island. So our future will be digital in the health system. This is our message to the world. We are organizing a new way to function with strong relations between primary care, hospitals, specialists, long-term care, a new vision of public health that becomes from the COVID situation, and with the specific use of the new pharmacs for all the patients and for all the pathologies that we have today. This is the older hospital, and we are changing for this one, the KV hospital, the hospital of the future. In the last few years, we had some evidence of what we are doing in response to catastrophe situations. The MRMI course that we lead in Portugal, we already made more than 30 courses and with the education program for 3,000 participants. This is running by the Madeira International Disaster Training Center. It was created in February 2016 because since 2010, Madeira facing several situations of disasters and catastrophe with the floods, with the fire, with the COVID situation, with the big accidents, with mass casual incidents. Our mentor was Professor Stan Lundquist for the European Society for Trauma and Emergency Surgery. He passed away last year, and we pressed tribute in the last Congress of European Society of Trauma and Emergency Surgery in Lisbon last April. One of the strengths of our health system is the education program with a simulation center that was created since 2012. We already made more than 700 courses with more than 6,000 hours of education program and with more than 11,000 participants. It's one of the simulation centers of Portugal with more activity. Some pictures of our activities in our hospitals in the Clinical Simulation Center. Now, what we have done since 2012 in vector-borne surveillance and disease control with the help of Patty Kostkova. So these slides will be presented by Bruno Gouveia in the next panel debate in today's afternoon. We learned about with COVID response. We can prepare the hospital with the medical responsible incidents as this response that Stan Lundquist showed to us. Our hospital is accreditation, have accreditation from the Health Director of Portugal. Our equipment cards in whole Highland has this distribution. And now we are starting our digital transformation. Our Atlantic health system will have redefined care delivery. With digital patient experience, we will promote enhanced health development with operational efficiencies through technology and with healing and well-being designs. As you know, the hospital of the future doesn't need to have patients that will be prepared and will be more prepared to give the answers that the patients need. We will have hospital at home. We will have the organization of the hospital like the new trends intends to show to us how we need to be organized. We will have interoperability and we will have robotization. We start with the new equipment for the OR. This is our president, myself, the clinical director, the OR director, and the nurse director. We are talking about digital transformation in 2024, and we thought that we are beginning this new journey. But we have digital transformation since 1992 with our program of Atrium. This Atrium program allows and permits that we have right now more than 6,000 electronic health records and more than 57.4 million clinical care episodes. This is right now our strength to start data analytics and to know if what we are doing well. This is our applications. We have 115 applications in Atrium, 77 external connection system, 3 portals, and 3 mobile apps. Our strategy is done at the center with interconnection of healthcare assistant episodes, use of national and international standards to certify and to have accreditation, have interoperability with external entities, and integration with healthcare identities. We start a new project for security, the Guardian from Philips, with implementation of 92 vital monitor sites across 21 nursing wards on 2 hospitals of SESARAM, Hospital Nélio Mendonça and Hospital dos Vermelheiros, to optimize patient care by automatically identifying signs of deterioration. Why is this so important? 4 to 17% of hospitalized patients suffer from a critical event. 66% of patients suffering from cardiac arrest have signs up to 6 hours before. However, the clinical staff is only notified 25% of the times. 35% of patients who are removed from the ICU end up dying in the general ward. And so, the Guardian is a very important project for our hospital for the secure of our patients. We learned with the pandemic situation to create several dashboards to identify our COVID-19 cases, to monitorize vaccination process, to monitorize the sentinel chain when the COVID was still in the end, and also with the new projects for the future, the imminent steps with mobility, interoperability, people-centered service, creation of a knowledge center, improve quality and security, and technology evolution with the smart glass for surgery, remote assistant and live surgery screening, artificial intelligence for cerebral pathology, and the robotic for general surgeon and for the orthopedic surgeon. This is our history of the digital transformation since 1992. Sorry, because the words are in Portuguese. But these slides want to show the hub that we create since 2019. The Health Innovation Hub, that is a hub that we want to potentiate our healthcare system. We start 4 projects with the new University of School Medical in Portugal in a program that we call Madeira Digital Health and Wellbeing, with 4 protocols: Smart for Health, the ICU for COVID, the Smart Bear, and the Quality Chain. 4 investigation projects that will be financed by the Age 2020, and that is running right now here in our island. We received some awards and some recognitions. One of them was very important because it comes from the International Hospital Federation, and we was awarded because of our strategy for COVID-19 in Madeira Island. We have, for International Hospital Federation, some success in our strategy to protect, start over, and recover. The final award was given by our President of the Portuguese Republic with the honorary member of the Order of Merit of Portugal. So the message from my presentation to all of you, it's a message to the world. With the creation of the new Central and University Hospital of Madeira, with the creation of the hospitalization in care, in home care, we started last year and we follow it since then more than 200 patients. The accreditation for digital health from Portugal, we have accreditation all of the primary care centers and 27 of the hospital. And the interest that we have right now to be part of the national strategy of the genomic medicine and the European community. Sorry, this is in Portuguese, but I think it is a comment that you know about Steve Jobs. In health system and everywhere, we need to know where the world goes on, and we need to arrive first. And if we need to arrive first, we need to understand what will be the challenge for the future until 2040. We will have change in the ambience, climate change, in demography, in economy, in technology, geopolitics, and in our societies, the organization of our societies. And we need to be prepared, putting the patient in the center, using the digital transformation, make the accessibility to home care be concretized, using digital health, and be worried about results, and use always in everything you do in the healthcare system, using the value-based healthcare. The value-based healthcare is related with quality and not with quantity. We need to get some experience in automation, in augmented reality, in data center, in data analytics, and also in quantum computation. Continuous improvement is preferable to delayed perfection, like Mark Twain says. We need to know what patient we will have in the future. We will have a digital patient. It is urgent to plan and build a new European health union. We have some good results in the management of the COVID-19. We need to improve and foster health in the Union. We need to protect people in the European Union from serious cross-border threats to health. We don't want another COVID pandemic situation. We need to improve medicinal products, medical device, and crisis-relevant products. And we need to have more strength in our health systems. We need to remove patients from the emergency department. Referentiation must be adequate. We need to think that in a project win-win for the government, they want emergency department without overload of patients. They want reduce of costs in health. They want quality trust between service and between population and healthcare system. For management, they want a better control of staff and a better control of the money. For the doctors, they want more satisfaction. They want more conditions for work. They want more, a better relation doctor to patient, door to door. And for patients, they want the doctor door to door. They want more satisfaction, more humanization, more clinical quality, and they want emergency department. They don't want to wait more than 6 hours to be attended. The doctor of the future, we need to understand what skills we need to have. Skills like values, education program, scientific culture. They need to know how to work as a team. They need to be resilient, and they need to have competence. This is some pictures of our new unit of intervention neuroradiology. Right now, for stroke, we are treating our patients, but we are treating also the patients from Azores Island. They are transported by the Air Force. They arrive in Madeira in 2 hours at least, and they are submitted to thrombectomy in our differentiated neurologic intervention radiology unit. That's why we are talking about the new Atlantic health system. Because right now we have connection with Azores. We treat the cardiac situations, the surgeons. We treat the obstetrician situations at risks. We treat the oncology related with gynecology. We receive patients for hyperbaric chamber also. And some trauma patients will transfer from Azores from Madeira. Right now, in this moment, because of the fire in the Principal Hospital of San Miguel Island, we receive 55 patients that needs to do hemodialysis with chronic renal insufficiency, and they are treated right now, living in Madeira, the treating by our health system. And that's how we intend that is going to be the new health system in Macaronesian Island.
It's been great to see your vision for the physical hospital which is being built in Funchal,
Okay.
but also the agenda for the digitization of the agenda as well as the home care. But also you mentioned the
Okay.
nurses and doctors, the staff who are essential to be trained and retained. So is there anything you would like to finish your presentation to have a take-home message for the audience?
Yes, I think the message in this slide, when we are in our position, we have the responsibility to leave society better than we found it.
Thank you so much. That's an excellent take-home message. So join me in applause for Dr. Pedro Ramos.
Thank you very much.
So we haven't got time for questions, so thank you ever so much for joining us today. And we look
Okay.
forward to welcoming you to London on your
Thank
next
you.
occasion.
Next July.
Thank you
Next
so
July.
much.
Okay, thank you, Pat.
Thank
very
you.
much.